PicoCare is our dual wavelength picosecond laser with two optional dye handpieces of 595 and 660 nanometers. This device is indicated for the treatment of pigmented lesions, tattoo removal, scar treatment, and skin rejuvenation. With the standard 532 and 1064 wavelengths, all skin types can be treated. The optional 595 and 660 wavelengths allow for treatment of colored tattoo ink, as well as some additional skin conditions. L532 is a low power mode utilizing the 532 nanometer wavelength and provides safer treatment for skin types 3 and 4. Within the device specs, we have our max energy output for each built-in wavelength, 300 millijoules for 532 and 600 millijoules for 1064. At 450 picoseconds, PicoCare has one of the most accurate pulse durations on the market. No rounding up. We're not overpromising and under-delivering. We have a wide range of spot sizes on multiple handpieces and adjustable repetition rates to allow for efficient treatments. Picosecond pulses fire at 1 trillionth of a second, compared to their technological predecessor, the Q-switched nanosecond laser, which fires at 1 billionth of a second. Here we can see the difference in the exposure time of the energy and the difference in the peak power between the two. So what do you get with picosecond technology? Firstly, a photoacoustic impact versus a photothermal impact. We're talking about the stress relaxation time of the target as opposed to the thermal relaxation time. With that, we get faster clearance of pigment and tattoo ink, as well as reduced risk of side effects like hyper and hypopigmentation, typically seen with heat-based treatments. Some unique features of the PicoCare include the ability to treat tattoo ink of all colors. Not only this, but due to the significant increase in fragmentation of the particles, clearance is achieved much more quickly compared to the previous gold standard Q-switch. We have the ability to address skin quality issues with cold rejuvenation, more on that later. PicoCare is also suitable for the treatment of melasma, traditionally very hard to treat and maintain in general, but especially when it comes to lasers, as melasma has a high sensitivity to heat and many treatments can exacerbate it. PicoCare's photoacoustic impact on the underlying pigment provides a safe treatment option for melasma sufferers of all skin types. The interface is very user-friendly and straightforward. Starting in the upper left-hand corner, we have the ability to select from presets as well as save custom settings to use for future treatments. Just below the PicoCare logo, the guide beam brightness is displayed and adjustable. To the right of that, we can see which wavelength is being utilized, and we can switch between L532, 532, and 1064 just by pressing the button. Treatment parameters are easily adjusted by pressing the up and down arrows on the left or right. In the center of the screen, the spot size is displayed and will automatically register based on the current spot size selected on the handpiece. Running shot count is displayed below that, and standby mode is easily activated by tapping the triangle. PicoCare comes standard with 4 handpieces: zoom, collimated, and 2 hexa MLAs. Zoom is the workhorse. This handpiece features a flat top beam profile and is used for tattoo removal and pigmented lesions, but can also be used for laser toning. The spot sizes range from 2 to 10 millimeters and are easily adjusted by gently pulling down on the body of the handpiece and twisting. No need for additional attachments. The collimated handpiece is designed specifically for toning treatments and is at a fixed 7 millimeter spot size. This makes up for energy discrepancies in distance variations from the tip of the handpiece to the skin. Our 2 hexa handpieces represent 2 ranges of spot sizes, 3 to 5 millimeters for the treatment of small areas, and 6 to 10 millimeters for larger treatment areas. The 595 and 660 dye handpieces are optional and consumable. 595 provides the ability to treat blue ink and red skin conditions, and the 660 allows for the treatment of green ink and pigment. The hexa handpieces contain a micro lens array, which concentrates the energy through a special lens in the handpiece. This lens fractionates the beam of incident light and provides 15 times the energy the zoom handpiece does. We have the ability to use either the 532 or 1064 nanometer wavelengths with spot sizes ranging between 3 to 10 millimeters. The ultra-short picosecond pulse duration combined with the increased energy intensity results in laser-induced optical breakdown. Laser-induced optical breakdown gives us cold rejuvenation, or our hexatoning treatments. We use this term strictly in comparison to traditionally thermally ablative lasers like CO2. Laser-induced optical breakdown leads to plasma formation in the tissues, which then gives rise to tiny cavitation bubbles. These bubbles eventually burst and release shock waves of energy throughout the dermal tissue, stimulating a wound healing response and leading to the formation of new collagen and elastin. With this, we have preservation of the dermal-epidermal junction, reducing the risk of pigmentary side effects and faster healing with fewer sessions typically required. We'll now take a look at each of our indications in order to help you talk your doctors through a comprehensive plan for integrating PicoCare into their practice. First up, we have pigment reduction. Pigment treatments with PicoCare can be done as individual spot treatments or as full-face toning. If a patient were to purchase a series or another high-ticket item, offer a complementary spot treatment to prove efficacy and shift the focus to pigmentary concerns. Proper skincare should be introduced to every patient coming in for treatment in addition to sunscreen. This provides the opportunity for a conversation about year-round prevention and protection. By educating their patients, they will incentivize them. For example, in the summer, everyone knows to wear sunscreen, but most people fall off in the winter or on rainy or cloudy days, and as we know, UVA does not stop aging the skin regardless of the weather. Hold a pigment-focused event at the end of summer or beginning of fall with discounts on treatment packages and series. IPL can often be combined effectively with PicoCare treatments, as well as ablative treatments for raised or textured seborrheic keratosis. Melasma. PicoCare is well suited to melasma sufferers by its photoacoustic mechanism of action. There are two big challenges when it comes to treating melasma. One, darker skin types are more prone to developing it, but are harder to treat safely with heat-based devices because, two, melasma is very sensitive to heat and can easily be exacerbated with such treatments. PicoCare has shown efficacy in reducing pigment effectively using very low energy. Melasma management packages can be offered with combined treatments such as microdermabrasion, chemical peels, or a comprehensive home care regimen. Melasma treatments with PicoCare tend to require more frequency of treatment, around 8 to 10 sessions, because the approach is extremely gentle. There is no cure for melasma, so these patients have the potential to become patients for life. Picotoning. Picotoning refers to a full-face treatment technique where the handpiece continuously moves across the skin so as not to overfocus the energy in any one particular area. This is primarily done for pigment and rejuvenation with either the zoom or collimated handpieces. Toning treatments are always recommended in a series and can be combined with other modalities such as microdermabrasion, IPL, and chemical peels, depending on the patient's skin type and what their goals are. Hexatoning. Hexatoning refers to the same technique as picotoning, however, it is done with the MLA handpiece. This provides full face rejuvenation with results comparable to what we would expect to see with an ablative treatment. One of the added benefits of PicoCare with this type of treatment is that both the 532 and 1064 wavelengths can be utilized, providing non-ablative rejuvenation for skin types 1 through 6, as well as non-ablative and brightening rejuvenation on skin types 1 through 3. Hexatoning can also be done as a final step to a picotoning treatment or at the end of the glamour peel. The best candidate for a hexatoning treatment would be someone with visible signs of aging on the face at rest. For this reason, offering discounts on packages for things like injectables, hydrofacials, or chemical peels are always a reliable option. Oftentimes, visible difference can be observed after one hexatoning treatment, and the downtime is negligible when comparing this non-ablative treatment to other ablative options that could offer the same end result. Scar reduction. The smaller spot size MLA handpiece can be used for scar reduction as a suitable replacement for subcision. This includes scars of all sizes, atrophic acne scars, enlarged pores, and deep wrinkles. Pricing for these treatments would be based heavily upon the provider performing them and the size or quantity being treated. Glamour peel. The glamour peel is PicoCare's version of a carbon laser peel. In this treatment, a thin layer of carbon cream is applied to the entire face and allowed to dry. This enhances the absorption of the laser and targets deep into the pores for maximum benefit. It's extremely satisfying to watch and provides a healthy glow following the treatment. This is a really nice option for men, acne sufferers, and those without significant signs of aging. With that being said, as we mentioned earlier, hexatoning can be performed at the end of a glamour peel to boost the rejuvenating effects. Onychomycosis. Rarely would someone anticipate that the very same laser that's addressed concerns on their face could also be used to treat this embarrassing condition. If a practice offers this treatment as part of their service portfolio, a unique opportunity to transition non-aesthetic clients into aesthetic ones and vice versa presents itself. Onychomycosis treatments are always recommended in a series and are rather quick to perform, so while this may not be every provider's cup of tea, the ROI is very good. Lastly, we have rosacea and acne. With the optional $5.95 dye handpiece, PicoCare also has the ability to treat rosacea and inflammatory acne. These treatments are also always recommended in a series and should always be combined with a skin type appropriate home care regimen. Thank you for your time, and as always, if you have any questions, ideas, or feedback, we would love to hear from you.